With 1 million new cases per year, breast cancer is one of the most common malignancies in women in the world. It accounts for about 20% of all neoplasms in them. In countries like ours, with an average life expectancy of more than 70 years, approximately 1 in 8 women will be diagnosed with breast cancer in her lifetime. Estimates suggest that the incidence of breast cancer will reach approximately 3.2 million per year by 2015. These figures reflect the impact on society worldwide and highlight the need of timely preventive measures. Our efforts in the team are focused on the development and validation of a panel of genes for monitoring tumor heterogeneity, molecular resistance, tumor burden, and minimal residual disease in patients with proven breast cancer.
Our work is development and validation of a panel of genes for accurate molecular diagnosis in patients with CML and also monitoring the minimal residual disease of these patients or MRD. With the advent of tyrosine kinase inhibitors, TKIs, the goals of therapy in chronic myeloid leukemia are steadily shifting. Long-term disease control of TKI therapy has been the goal and expectation for most of the patients. More recently, treatment-free remissions, the so-called TFR, has entered the mainstream practice and also is increasingly being adopted as the main goal of therapy. This has necessitated the refinement and dissemination of highly sensitive measurement of BCR-ABL1 expression. The standard method is real-time PCR. It must be said that there are some disadvantages of the method, especially when we are looking for a deep molecular remission in patients who are the group targeted for treatment discontinuation. This is the place of the digital droplet PCR, which can very accurately measure quantitatively and in absolute values the BCR-ABL1 expression. So with refinement and monitoring the treatment goals and also very precisely defining the patients who will be able to discontinue therapy, this is the major advantage of this method. Along with this aspect of our work, we also perform mutation analysis in patients with suboptimal response to TKI therapy with CML. And as early as we prove a loss of response or suboptimal response, we look for a number of mutations. The most difficult to manage of them is T315I, and we have already described 10% presentation of this mutation in our patients who have worse performance compared to the standard group and have shorter survival. So to these patients, in a timely manner, we can offer effective therapy.
Our research is in the field of oncology and pharmacogenetics. We developed and are implementing in clinical practice tests for an earlier and more accurate diagnosis of cancer by minimal invasive approaches that lead to precise personalized therapy and prognosis and monitoring for minimal residual disease for each individual patient.
We have optimized and validated the pre-analytical phase for extraction of cell-free tumor DNA, and we are trying to implement and develop a pipeline to detect somatic and germline mutation in that tumor DNA that will help to monitor the minimal residual disease, to help choose the best target treatment for that patient's cancer, and in the pharmacogenetic field to choose the best drug and the best dose for that patient.
And this is our flow cytometry lab. This new system that was obtained thanks to the project is flow cytometer and sort of area 3 system, and it helps us to conduct highly specialized flow cytometric analysis of bone marrows from children with acute lymphoblastic leukemia, and after that to monitor the minimal residual disease. Up to now we have analyzed more than 200 children, newly diagnosed and follow-up samples, and this helps us to tailor the therapy according to the risk level for the patient, depending on the minimal residual disease percentages. So this is in the view of the personalized medicine, and it is very important stratifying criteria in the therapeutic protocol for these children. Ultimately, the aim is to facilitate, to make it as a routine test and to help improve the quality of life after all of these patients. This is just one sample of a newly diagnosed child, and here you can see the large amount of blast cells of this patient. So after that he will be followed up at certain time points which are proven to have important therapeutic implications.
My name is Stanislava Semyonova. I'm assistant professor and doctoral student at the Department of Pharmaceutical Sciences. The laboratory in which we are located was created under the PERIMED project to support the personalized medicine. One of our main purposes is to create successful nanoscale carriers which could be used in the targeted therapy. At this point, the direction in which my team and I are working is to establish the optimal conditions for synthesis, optimization and characterization of iron oxide magnetic nanoparticles. Worldwide, they are developed as potential biomarkers and nano carriers in diagnostic and targeted therapy.
Our team is working on the preparation and characterization of biodegradable nanoparticles which are loaded with chemotherapeutic agents. With the method of scanning electron microscopy, we can visualize, we can determine the particle size and morphology of the obtained biodegradable nanoparticles.